South Africa. Yesterday, the country recorded more than 10,000 new infections in just one day. That takes the total cases to 215,855. The country also recorded its worst 24-hour COVID-19 casualty rate yesterday. 192 more people died, taking the overall death toll to 3,502. South Africa now has the 14th highest number of infections globally. We've overtaken France and Germany. To discuss the surge in cases, the possibility of higher lockdowns, as well as South Africa's readiness for the storm, we're now joined via Skype by Professor Alex van den Heever from the School of Governance at Wits University. Professor, thank you for being with us. Can we say the storm has hit or is hitting now?
I would actually disagree with that. I mean, I think we are facing a storm, but the question is whether this was something that was expected. The serious increase we're seeing now is largely a consequence of the inadequate prevention programs that are in place in a number of provinces. And that's really the reason why you see a suppression of the epidemic in many countries. It doesn't come from reaching a peak naturally. It comes from reaching a peak because of policy interventions. So what we're seeing now is revealing serious weaknesses in how we're attacking the epidemic.
Wasn't there always going to be some sort of peak? I mean, what you're saying is sort of in contrast to what many of our main authorities are saying, that this could not be avoided. There was always going to be mass infections. We've heard from doctors. There was always going to be a surge. It was just about delaying and flattening the curve.
No, that's inaccurate. If you had to look around the world, the countries that have turned the epidemics down have done so through how they've intervened. So it's really how the prevention strategies are implemented and the level and period in which they're implemented. So South Africa did not implement testing and tracing at scale at the right time and did not really make use of the lockdown to effectively prevent the epidemic from taking off. There would be absolutely no point in having a lockdown if our intention was then to leave the epidemic to just run amok and then hope that our health services can cope with the consequences of that. That is not a strategy and not a coherent plan. Yeah. I would argue that there is a tendency now for people to raise this narrative, to avoid essentially having to deal with the fact that our prevention strategy has not been effective and not been effectively implemented to date.
Can I challenge you again? Because hospitals, we have spoken to healthcare workers saying that plans are in place. We know that PPE has been sourced. The Solidarity Fund, many people in the private sector giving their time for free, working with government, trying to find where those gaps are. We've seen quarantine sites set up. We've seen NASREC set up. Why is this all falling so short for you?
Well, let's distinguish between two types of interventions. There are interventions to prevent the epidemic from becoming serious, and there are interventions to expand and strengthen the actual treatment side of the epidemic. There is virtually no expansion that we could introduce that would be able to cope with an uncontained epidemic going forward. There has to be something that suppresses the epidemic for it to be at manageable levels. And that suppression is not through the lockdown, because the lockdown could never have been anything but a temporary measure in South Africa. And right now, we are not seeing that our health services in Gauteng and the Eastern Cape are able to cope with the surge. They're on the edge of collapsing. And this does have to be well understood. It is not merely about PPE, it's about the availability of beds, oxygen, critical care beds, and access to the private sector, which is also facing the surge as well. Yeah. So we just don't have enough beds and we don't have enough staff to cater for an uncontained epidemic.
We are speaking to you because you have been looking at our general readiness. So just explain what you've been saying. It sounds very concerning. You said we would need 3 million bed days. Explain what that is. And we're sitting on less than 500,000, I think you've been saying.
So if we essentially have an uncontained epidemic the kind of level of bed requirement is completely out of our capability. It's also outside the capability of first world industrialized country. So we're never ever going to get to that level. So what we've introduced at Nasrec is never going to be sufficient, and the beds in Nasrec are totally inadequate to treat patients. There's no oxygen there. There are no staff there at the moment. So at this point in time, the Nasrec facility is useless for the treatment of patients. Yeah. They're going to have to urgently step up care in that particular facility to just be able to cope with the current surge. But our current hospitals are going to have to deal with it. And we're also facing the situation, a lot of our health services are closing because the staff are getting infected.
What would you like to see? Testing, tracing, also important. We know that South Africa wants to do testing en masse. We've heard about the shortages of test kits that don't only affect us, but many countries in the world. What is within our power to do right now?
So at this point, we're actually testing at sort of relatively significant levels. The problem is that the number of new cases has increased to such a level that even a coordinated strategy might have limited effect. But should still have a coordinated strategy between the public and private sectors as well as the university laboratories. We are testing at levels, for instance, higher than South Korea would have been testing in January when it managed to suppress the epidemic completely in that context. So, but what is concerning is that the private sector is exceeding the public sector in the number of tests, despite the fact they access the same supply chains as the public sector. And it's unclear why the public sector is bottlenecking and the private sector is not. So there is a question as to why we haven't reached the scale that we could have reached earlier on in this epidemic, because that would have been absolutely critical. Epidemics are suppressed by very basic measures, testing, tracing, and quarantining as one of your fundamental pillars. And that's one fundamental pillar that was meant to take over from when we moved out of the lockdown. And we haven't been able to do that. So now we're moving into an epidemic phase where we've got limited resources that we can attack the epidemic with. And treatment facilities are never really going to be able to deal with the scale of the cases that are going to come forward. So I think that what we do need to see going forward is, regardless of the resource constraints, we are going to have to attack these hotspots aggressively. We are going to have to message properly around prevention. We are going to have to understand and get the public to understand the risks associated with a high probability that a large part of this epidemic is spread in the air. And we have to deal with how we are protecting these public spaces, including bulk transport facilities, etc., and our places of employment and education, all of which now are potentially becoming vectors in the epidemic.
Well, you've raised something important, the news that COVID-19 probably is airborne. I mean, how does that change the way this is all being handled?
Well, it raises the possibility that in certain circumstances, your PPE that you're wearing is not going to be sufficient to protect you. So if you're in an enclosed space, which has poor ventilation, there's the possibility that the virus may be lingering in the air in that environment. And if you're in that environment for any length of time, you may receive a dose of the virus that is sufficient to cause an infection. Now, the question really is how we message to warn people to be wary in those situations, but also to ensure that those spaces are now properly ventilated. So air conditioning that recirculates existing air is problematic, but places that can open windows and be exposed to the outside can substantially reduce the risk. So we have to be looking at that. We also have to look at what kind of protocols need to change within the healthcare setting, because a lot of healthcare workers are being infected. We also need to look at very basic interventions, such as lowering the windows of taxis and buses for bulk transport, because right at this point, what this trajectory of the epidemic suggests is that we are not containing super spreading contexts and events. And it's and these are the ways to address those. Is really to make sure that there is adequate ventilation in areas where super spreading is a high possibility.
Okay, so this is such an important issue. I mean, it's incredible that we haven't known for this long that it could be airborne, that the WHO has been talking about droplets, but this is a new disease. So what is your message then before we end to workers like me going into the office? So you just try and go where there is ventilation. Should you maybe change what you're wearing? Are you talking about the mask not being sufficient?
So any space which has poor circulation, so even areas like public toilets are problematic because there's the possibility that flushing a toilet aerosolizes the virus because it's carried in feces, for instance. It does suggest that people have to exercise incredible caution at workplaces, and that special attention has to be given to ventilation. But just to point out that what is happening now is that people are arguing that this, although the science is not absolutely conclusive of this, the evidence that is emerging is highly suggestive that this is a key area of risk that needs to be managed. And it really means that from a preventive perspective and from an excess of caution, we need to manage this particular aspect, because it's probably why we're seeing such a large number of infections at this point, because people are doing all the basics, but they're not addressing this particular risk.
If COVID-19 is airborne, making it more difficult for all of us, including employers. Thank you very much for your time. That was Professor Alex van den Heever from the School of Governance at Wits University. Well, abandoning the 2020 academic year is